Hello, dear friends. How are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 19-year-old student presents with a 3-day history of a 1 centimeter golden crusted lesion on the border of her lower lip. What is the most suitable management? A. Oral coamoxicillin. B. Oral penicillin. C. Oral flucloxacillin. D. Oral flucloxacillin plus penicillin. E. Topical fusidic acid. Okay, here we have a young student coming with a 3-day history of 1 centimeter golden crusted lesion on the border of her lower lip. It shows that the patient has impetigo, and the impetigo is localized and small. And the treatment of choice in localized and small impetigo is topical fusidic acid. Okay, here we are going to explain it. Explanation: in small and localized impetigo, topical fusidic acid is first line. This history is typically of impetigo. If the lesion is small and localized, topical fusidic acid is recommended. Impetigo is a superficial bacterial skin infection usually caused by either Staphylococcus aureus or Streptococcus pyogenes. It can be a primary infection or a complication of an existing skin condition such as eczema, scabies, or insect bites. Impetigo is common in children, particularly during warm weather. The infection can develop anywhere on the body, but lesions tend to occur on the face, flexures, and limbs not covered by clothing. As we can see here, we can see impetigo in different patients. Here we can see involvement of the auricle of the ear. Here we can, and also external canal. Here we can see involvement of mandible in this child. Here we can see perioral impetigo in this child, and also here we can see involvement of nostril perioral involvement. Spread is by direct contact with discharge from the scabs or an infected person. The bacteria invade skin through minor abrasions and then spread to other sites by scratching. Usually spread is by direct contact with discharge from the lesions of an infected person. Infection is spread mainly by the hands, but indirect spread via toys, clothing, equipment, and their environments may occur. And this is important for the children which go to kindergarten. If they have impetigo, they must be kept away from their kindergarten until or from the school until their impetigo is treated, because it can spread by indirect via toys, clothing, equipment, and their environment. The incubation period is between 4 to 10 days. Features usually present with golden crusted skin lesions typically found around their mouth. As we can see here, this is a typical presentation of impetigo. We can see golden crusted lesions around the mouth, and these lesions are very contagious. Management of impetigo: limited localized disease. Topical fusidic acid is first line. Topical retapamulin is used second line treatment if fusidic acid has been ineffective or is not tolerated. MRSA is not susceptible to either fusidic acid or retapamulin, but topical mupirocin with a commercial name or Bactroban should therefore be used in this situation. In patients with MRSA or methicillin-resistant Staph aureus, fusidic acid or retapamulin are not responsible. The treatment of choice is mupirocin or Bactroban. In extensive disease, oral flucloxacillin is the first choice, and oral erythromycin if the patient has penicillin allergy. Children should be excluded from school until the lesions are crusted and healed. or 48 hours after commencing antibiotic treatment. As we said, it's very contagious, and children which are going to school or going to kindergarten, they must be excluded from until the lesions are crusted and healed, or 48 hours after commencing antibiotic treatment. Okay, it was a short explanation about Impetigo presentation and management. Thank you for your attention.